For orientation, the aorta and aortic bifurcation are located here. The pubic symphysis is anterior. In the midline, with the string tied around the transected sigmoid colon becoming the rectum, the uterus, and the urinary bladder. So parietal peritoneum that lines the anterior abdominal wall continues over the urinary bladder, dips down into a recess, and then is reflected back up onto the fundus and a portion of the body of the uterus. So this rounded portion here is the fundus. Then it continues down around the inner surface or undersurface of the uterus to continue down into the pelvic basin before sweeping back up onto the rectum and to the posterior abdominal wall. So let me go back and identify those recesses. Right in here between the uterus and the bladder is the uterovesical pouch. More important clinically, because it's the inferior most extent of the peritoneal cavity, would be the pouch recess that is between the uterus and the rectum, or the recto-uterine pouch. So down on the floor here, this deep concavity is the recto-uterine pouch. Eponym for that is pouch of Douglas. The peritoneum that covers the uterine fundus and the body of the uterus that we see on either side here is continued laterally to help suspend the uterus in the midline, and it's the lateral reflections of the peritoneum around the structures that are attached to the margin of the uterus that are called the broad ligament. And I'm going to go through and demonstrate some of those structures for you on this right side. One structure is the round ligament of the uterus that you see attached to the side wall near the fundus, continues into the deep inguinal ring, and we studied that in the inguinal region. More posterior to that is the uterine tube. Try to straighten this out so you can see the parts of the uterine tube, all the way to the fimbriated end and back to its attachment to the fundus of the uterus, surrounded by peritoneum. And then even more posterior to the uterine tube is the ovary, which you see right here. Again, peritoneum connecting uterine tube to the ovary. There is another ligament that goes from the inferior pole of the ovary down to attach to the side wall of the uterus. This is the ovarian ligament, or the proper ovarian ligament, as it's sometimes called, to differentiate it from a ligament that continues up into the abdominal cavity, and that's been transected here. Now, no, it really hasn't. The peritoneum has, but the structures, let me get that out of the way. The structures that course through this other ligament, right in here, the suspensory ligament of the ovary, bringing in the ovarian artery and draining blood through the ovarian vein, as well as lymphatics and autonomics. Okay, all of these structures are associated with the broad ligament, which is the peritoneal reflection that goes from the uterus to the lateral body wall. Having completed the splitting or bisecting of the pelvis, let me give you some orientation of what we can look at here. Here is the sacrum, sacral promontory coming down towards the coccyx right about here. Pubic symphysis anterior. So the plane of the pelvic outlet would be right across there, and the pelvic brim would be up in this region. And you can see the couple of organs of viscera here in the midline that we can identify the structures. The urinary bladder, the body, or the cavity, and that continues down into the urethra, which continues down through the urogenital diaphragm, which would be about in that plane right underneath the pubic symphysis, so the membranous part of the urethra there. Just posterior to that would be the uterus with the fundus and the body here, the cervix down in this region, and this would be one of the pouches, the vesico-uterine pouch. In looking more carefully at the cervical region of the uterus, you can, on this specimen, identify the ostium of the cervix, which continues through into the cavity at the body of the uterus. The vagina is right here, continuing inferiorly. Posterior wall leading up to a posterior fornix, which is right here. This is the area that's close to the recto-uterine pouch. The anterior fornix would be tracing the anterior wall up, and a cul-de-sac right in here. Okay? And then posteriorly is the rectum becoming the anal canal. Not really obvious here, but there's about a 90-degree turn, the rectum being in this orientation and the anal canal being in this orientation. To continue the dissection on this side, we'll look at the vascular system first and then the nerves forming the lumbosacral plexus, or basically the sacral plexus. So again, uterus here, broad ligament, ovary, uterine tube, a little bit of the round ligament. We're going to move those out of the way along with the suspensory ligament. Move that all medially. And over the promontory of the sacrum, usually find retroperitoneal position of some stringy nerves that represent the hypogastric nerve descending into the pelvis. Up in this area, variable place around the promontory, the superior hypogastric plexus. I'm going to pull that free from the pin that held it down, and we'll trace that down later in just a minute. Let me move this all out of the way medially so you can look down on the branches. The ureter is right here. I'll leave that in place for a moment. So what we're going to trace is the internal iliac artery. Continuing this way is external iliac, common iliac. And following along branches in an anterior position and the pelvic brim here first and working down deeper and deeper. This is the obliterated umbilical artery that courses to the anterior abdominal wall and conveys blood up to a variable position before it becomes a connective tissue cord. If we turn this specimen back in this direction, hanging on to the umbilical artery, which is not obliterated right here, and spread this tissue out, and let me point to the bladder so we have that as a reference, we'll see tiny little vessels that course down from the umbilical artery to the superior surface of the bladder, and these are superior vesical branches. Okay? Tiny little branches coming off the umbilical artery. On this specimen, there's an aberrant or abnormal origin of the obturator artery, which in this case is coming off the external iliac. Normally it would come off the internal iliac back here, run parallel to the obturator nerve. Okay? This happens in about 10 to 15% of the cadavers. The next artery that we can see in the female anatomy is the very important uterine artery that I'm tracing right now, heading over towards the cervix level of the uterus. And the way you identify that is to see the position of the artery relative to the ureter, which when you're right next to the cervix of the uterus goes inferior to the uterine artery, or water under the bridge. Now I'm going to move the ureter out of the way so you can see in a little deeper now. So this was the uterine artery. Okay, now let's look at the remaining branches of the internal iliac that come off in a more posterior position. So again, here's the beginning of the internal iliac artery, and the first branch off of that is called the iliolumbar artery, and that ascends along the lumbar vertebra. Continuing down the length of the internal iliac, we see another branch that comes off the internal iliac, heading medially to the sacrum. It is called the lateral sacral artery, to contrast it from the median sacral artery that we don't have you dissect, that runs right down the midline. The next branch coming off this large internal iliac is very deeply positioned here, very large branch. It's called the superior gluteal artery. It normally dives deep from your view in this dissection between this bundle of nerve, which is called the lumbosacral trunk, and this huge nerve, which is the ventral ramus of S1. Normally that artery dives right down in there. In this specimen it is going on the other side, or the superior side of the lumbosacral trunk. Nevertheless, that is the superior gluteal artery. The inferior gluteal artery is this branch that's coming off at a more distal point, much smaller in diameter, and it disappears between branches of the sacral plexus. And then finally, the deepest artery, and oftentimes small artery, the deepest that comes off the internal iliac yet stays inside the pelvic basin, is always the middle rectal artery, heading over towards the ampulla of the rectum. There are larger branches here, but they exit the pelvis, so this is the deepest one that stays within the pelvic cavity. And the final branch that you can see exiting is seemingly the continuation of the internal iliac artery, is this branch. That is the internal pudendal artery. And this big opening right here is the greater sciatic foramen. Okay, now the nerves in this region, we've finished the arteries. Come back, lumbosacral trunk represents the ventral rami of a little bit of L4 and a large bit of L5 that fuse together to form this trunk. S1, S2, and S3 ventral rami are obvious here as we count sequentially down, all sitting on a muscle in the background that is the piriformis muscle. These large nerve bundles right here are the ventral rami of S1, S2, and S3. Look for branches that come off of these ventral rami and head towards the connective tissue adjacent to the rectum. And these branches, I see one down in here, and I see a branch right in here, and I think another one right in there. These branches are pelvic splanchnic nerves that are going into a region right here that's called the inferior hypogastric plexus, and those nerve bundles are met by the superior hypogastric plexus via the hypogastric nerve that I'll strip free there, and that's the nerve that I originally had coming over the sacral promontory. All of these nerves are converging to an intermingling of nerves right adjacent to the rectum. Inferior hypogastric plexus or pelvic plexus of autonomic nerves. Pelvic splanchnics are usually off of S3 and S4. They also can come from S2, but you usually don't see them as clearly. These are preganglionic parasympathetic axons inside the pelvic splanchnic nerves. Finally, here is the sympathetic trunk in the sacrum, so referred to as the sacral sympathetic trunk. It has a couple of gray swellings, or the ganglia, along the sympathetic trunk. It continues down inferiorly, but it's best seen right here. Coming off the sacral sympathetic trunk, you'll find gray rami communicantes, or gray rami, that are connecting to the adjacent ventral rami of the sacral plexus. In this case, I'm holding S1 ventral ramus, and there's a gray ramus right there. And finally, there's a branch off the sacral sympathetic trunk that runs into the hypogastric plexus, the inferior hypogastric plexus. This is a sacral splanchnic. Sacral splanchnics give sympathetics, pelvic splanchnics down deeper give parasympathetics to the same plexus. We switch to the male specimen here that's already been bisected to go through quickly a couple of the important male organs in the pelvic cavity. For orientation, pubic symphysis is here, sacral promontory here, and you can see the penis and the erectile tissue in this area. Urinary bladder is right here, and the lumen of the urinary bladder gives rise right here to the urethra that courses through this structure, which is the prostate gland. So this would be the prostatic urethra. Right through here it goes into the membranous urethra, and this would be the position of the urogenital diaphragm, and then continues down as the penile or spongy urethra. Okay? Now, posterior to the prostate, back in this region, is the ampoule of the rectum, which leads down into the anal canal here. So in doing a rectal exam of a male, you would be palpating through this anterior wall of the rectum to palpate the posterior margin of the prostate to see if there's hypertrophy. The area guarded by the opening of the urethra into the prostate is a triangular smooth muscle area called the trigone, a common area for hypertrophy of portions of the prostate to bulge into and sometimes seal off the urethral orifice. Between the rectum and the prostate, you'll find two other structures related to the reproductive tract in the male. Holding in the forceps is a very small, usually larger seminal vesicle, very lumpy bumps on it that you can feel here easily through the rectal exam. And then this cord-like structure is the ductus deferens, vas deferens. The two come together at about this point, and we actually see them right here forming a single channel. This is the ejaculatory duct, which passes through the prostate to enter into the prostatic urethra. So those are the structures of the male pelvis.